Many Canadians find winter not the cheeriest time of year. For some people, it causes more than just the blues. Seasonal Affective Disorder, or SAD, is in full swing at this time of year when it can feel like spring will never arrive. Dr. Karl Kabasele is our medical contributor. Dr. Karl, what exactly is seasonal affective disorder?
Well, as you pointed out, it's a form of depression, but the hallmark of the disorder is the seasonality. I'd venture to say that most of us in Canada, to some extent, are affected by the weather. But when it progresses to the point where it becomes a clinically disabling condition like clinical depression, that's where we put the label SAD on it.
So what's different between that and depression?
Well, depression doesn't have that seasonal component to it, but you're still going to get those similar types of symptoms where you have a low mood, low energy, you may have trouble sleeping, things where you normally would have had pleasure, you don't get that anymore.
Do we know what causes SAD?
It's not clear exactly what it is, but the theory is that it's the reduction in the amount of light that people are exposed to that seems to have an impact on levels of serotonin, the sort of feel-good hormone in your blood. And that's why it seems as though when people are exposed to more light, they tend to get better, especially if they have a milder case of SAD.
What kind of light?
It could be as simple as just, opening up the drapes and letting the sun come into your home, or getting outside during the daylight hours and being exposed to sun. But there's also a thing called a SAD lamp, which is a light that you can put on your desk. You look into it or look in its direction for about 30 minutes a day, and it can actually elevate the mood. Now, it's a special lamp because it's about 25 times the brightness of a regular lamp.
Now, are some people more at risk of developing SAD than other people?
Yeah, for some reason, women are more likely to be affected. In fact, some studies say they are 4 times as likely to be affected. Also, your distance from the equator. So the more north you are, in Canada's case, the more likely you are to be affected. And that's probably because, the farther north you go, the shorter the days become in the middle of the winter.
How common is this seasonal affective disorder?
Well, the estimates are anywhere between 2 to 5% in terms of severe seasonal affective disorder. And then there's probably on top of that another 15% of the population that has a milder form of the depression. But when you add on top of that, probably between 25 and 35% of people that just get winter blues. You just feel a little bit lethargic during the winter. You can see where it sort of potentially affects the majority of Canadians.
Is this the kind of thing that would keep people off work?
It could potentially. In its most severe forms, the insomnia, the lack of energy, all of these things make people less productive and may, frankly, take them out of the workplace.
So we know about light therapy. What else can you do?
Well, other things that work, especially in more severe cases, are antidepressants, the same medications that you would take if you had clinical depression. And in particular, the class of drugs called SSRIs, which includes the Prozac and Zoloft and Paxil, so some of those familiar names. And as with depression as well, talk therapy can really make a difference, especially in combination with antidepressants.
All right. Well, thanks for talking about it with us today.
Thank you.
CBC medical contributor Dr. Karl Kabasele.